Can AI put your life at risk? Imagine this. You're experiencing chest pain. Your arm feels numb. You reach out to your healthcare provider, hoping for answers. But instead of a doctor, you're met with a chatbot powered by artificial intelligence. This AI tells you it's just a panic attack. But deep down, you're not convinced. This isn't just anxiety. Something feels seriously wrong. Sadly, this scenario isn't from a science fiction novel. It's a terrifying reality. The increasing reliance on AI in healthcare, while promising in many ways, has also opened the door to potentially life-threatening risks. Misdiagnoses, like the one we'll discuss, highlight the critical importance of human oversight in healthcare. While AI can be a helpful tool, it should never replace the judgment of a trained medical professional. This topic will delve into the alarming case of Babylon Health's AI misdiagnosis, exploring the limitations of artificial intelligence in healthcare. We'll discuss the importance of seeking second opinions from human doctors and emphasize the need for a balanced approach, one where AI assists, not replaces, the irreplaceable human touch in medicine. The Babylon Health case. In a chilling real-life incident, Babylon Health, a company known for its AI-powered healthcare chatbot, faced serious scrutiny. Their chatbot, designed to provide medical consultations, tragically misdiagnosed a potentially fatal condition. A 66-year-old smoker, experiencing telltale symptoms of a heart attack, chest pain, and arm numbness, turned to the chatbot for help. Alarmingly, the AI downplayed his symptoms, suggesting it was merely a panic attack. This misdiagnosis could have had devastating consequences. Heart attacks require immediate medical attention. Delaying treatment can lead to irreversible heart damage or even death. This case underscores a crucial point. While AI can analyze data and identify patterns, it lacks the nuanced understanding of human physiology and the ability to factor in individual patient history that are crucial for accurate diagnosis. The Babylon Health case serves as a stark warning about the limitations of AI in healthcare. It highlights the dangers of relying solely on technology for diagnosis, especially for complex and potentially life-threatening conditions. Can technology outperform human expertise? The potential of AI in healthcare is undeniable. From analyzing medical images to predicting disease risk, AI offers exciting possibilities. It can process vast amounts of data in seconds, something that would take humans hours or even days. But does this mean AI can replace doctors? The answer, unequivocally, is no. Despite advancements, AI still falls short in crucial areas. Human doctors bring years of education, training, and experience to the table. They can pick up on subtle cues, like a patient's tone of voice or body language, that AI might miss. Moreover, doctors can empathize with patients, a quality crucial for building trust and understanding their concerns fully. While AI excels at identifying patterns in data, it often struggles with the nuances of individual cases. Medical diagnosis isn't just about analyzing symptoms. It's about understanding the person behind the symptoms. Until AI can replicate the empathy, critical thinking, and adaptability of human doctors, human oversight remains non-negotiable. The limits of artificial intelligence, why we can't rely on AI alone. The allure of AI in healthcare is undeniable. Proponents tout its potential to increase efficiency, reduce costs, and improve patient outcomes. While these benefits are attainable, it's crucial to acknowledge the inherent limitations of AI and the risks associated with its unchecked application. One major concern is the risk of bias. AI algorithms are trained on massive datasets, and if these datasets reflect existing healthcare disparities, the AI can perpetuate and even exacerbate these inequalities. For example, if an AI model is primarily trained on data from a specific demographic, it might not perform as accurately for patients from other backgrounds. This could lead to misdiagnoses and inadequate treatment. Furthermore, AI lacks the adaptability and flexibility of human doctors. Medicine is a constantly evolving field, with new research and discoveries emerging all the time. While AI can be updated with new information, it's not as adaptable as a human doctor who can critically evaluate new research and apply it to individual patient cases. Relying solely on AI for medical diagnosis could stifle innovation and limit the scope of treatment options available to patients. Trust but verify. The importance of human oversight in the age of AI. The integration of AI in healthcare is not about replacing doctors, but about empowering them with better tools. AI can assist in analyzing medical images, flagging potential risks in patient data, and even suggesting treatment options. However, the final decision-making power must always rest with human medical professionals. Patients must be active participants in their healthcare. Don't hesitate to question an AI-generated diagnosis, especially if it doesn't feel right. Seek a second opinion from a human doctor, someone who can consider your individual circumstances and medical history. Remember, you have the right to be fully informed and involved in your healthcare decisions. The future of healthcare lies in a collaborative approach, one where AI and human expertise work hand in hand. By embracing a trust but verify mindset, we can harness the power of AI while ensuring patient safety and maintaining the irreplaceable human touch in medicine. And that's a wrap on today's exploration into the fascinating realm of AI anomalies. If you enjoyed unraveling the mysteries with us, don't forget to show some love. Hit that like button, subscribe to our channel, and make sure to click the notification bell so you never miss a moment of our captivating insights. Until then, stay curious, stay connected, and keep exploring the wonders of AI with us.